Hello, this is Matthew Fabian. I'm a bariatric surgeon at the Mason City Clinic. I originally grew up in Fargo, North Dakota, and had practiced there for 10 years before moving to Mason City about a year ago. Thank you for tuning in to our bariatric surgery presentation. I'd like to talk to you today about our program. What you'll learn about during this presentation are the following 5 topics. First of all, we'll talk about morbid obesity and what is it, how do we define it, when do we start thinking that you have that condition, and we talk about what are the benefits of surgery, how does it help people, and would you be a good fit for having an operation to help you with your morbid obesity. We offer a couple of different types of surgeries, and we'll talk to you about the differences between those types of surgeries and also the similarities. We'll talk to you about what it takes in anticipation of surgery. What are the guidelines or the requirements in order to have one of these weight loss surgeries performed? And finally, we'll talk about what are the things you should do to prepare. What kind of things can you do to get ready for the operation and get ready for your appointment with Dr. Fabian, myself, down in Mason City. So let's talk about how we define morbid obesity. The question is, what is morbid obesity? Well, I think we all know when we see somebody and we know that they're out of shape and they have some obesity, but when do we start thinking about recommending an operation to help you with your morbid obesity? Well, we use what's called the body mass index, and that's abbreviated BMI, and we can use an online body mass index calculator, which you can look up at any time and use your weight and your height, and it will tell you the number. And if you know your height and weight, you can calculate your body mass index. And we start worrying about bariatric surgery or having morbid obesity when your body mass index is greater than 35. Morbid obesity is a worldwide problem. It's getting to be more and more of a problem every year in the United States, in Iowa, in the world, in other countries around the world. We have more and more problem with people getting to be heavier and heavier. Well, why is it a concern, or why do we pay attention to it? Well, the people that have morbid obesity are more likely to develop all those medical conditions like diabetes, high blood pressure, joint disease like arthritis. It can be very bad arthritis that might even lead you to have to go to the doctor for it. It can be vein disease like blood clots in the legs or varicose veins. It could be sleep apnea, a very common condition that a lot of folks around the northern Iowa, southern Minnesota area are suffering from. So if we can correct the morbid obesity, a lot of times we can help these conditions to go away and never come back again. So not only are there benefits of surgery to helping you lose weight, but along with that weight loss comes improvement or resolution of diabetes, high blood pressure, joint disease like arthritis in the knees and hips. We see improvement or resolution of sleep apnea. That leads to decrease in medication use. Those of you that are taking metformin or insulin for diabetes, or you're taking lisinopril or metoprolol or hydrochlorothiazide for blood pressure, we can get you off of many of those medications. We also think about gastroesophageal reflux disease, heartburn. It can be cured with these operations. All of those benefits, when your knees feel better, when you're not using medications as much, when you're not having to pay attention to your blood sugar every day, when you can get off the couch and move easier because you're not carrying around an extra 50 or 100 pounds or more, it leads to improved psychological well-being. Are we going to cure depression with weight loss surgery? Well, not necessarily, but we just like to improve the quality of life. The first operation I'd like to talk about is the gastric bypass. All of the operations that I recommend are laparoscopic, meaning that they're minimally invasive. We use little incisions in the abdomen under general anesthesia to make the changes to the digestion that help you suppress your appetite, make it so that you're not so hungry, make it so that even when you do accidentally eat something you're not supposed to, or or eat a little bit too much, it prevents you from eating very much food at a given time, which is what leads to the weight loss. Gastric bypass works by connecting the small intestine to a little pouch of stomach, where the stomach ends up becoming about the size of a walnut or so, holds enough food for about one bite temporarily. That bite or swallow of food moves out of the little pouch after about 5 minutes and makes room for the next bite or swallow, making it so that a person who's had this operation will eat a very small amount of food and therefore will lose weight to get to the weight that they're more comfortable at, and it's a more healthy weight for that individual. Gastric bypass works by suppressing the appetite as well because of the hormonal aspects of the operation. Those hormones are made by the intestine. When you have undigested food in the downstream small intestine, the intestine will make hormones that suppress your appetite. I'm not talking about the types of hormones regarding fertility or menstrual cycles or testosterone. I'm talking about a separate type of hormones that affect when you're hungry or when you're not very hungry. And the operation helps turn off the I'm hungry hormones. I really like gastric bypass because it's a safe procedure. It's been done for a very long time. Since the 1980s, it's been commonly performed in the United States. It is a wonderful balance of weight loss, and it is a low-risk operation. So those are the reasons why I really like and recommend laparoscopic Roux-en-Y gastric bypass. As much as I like the laparoscopic Roux-en-Y gastric bypass, there are some complications that can happen. This is just a list of some of the complications that we see and manage and take care of. And the thing I want to emphasize is that these complications are correctable, and they're temporary. And many of you have heard about the complications of gastric bypass. And especially if you're suffering from one of them right now, I would like to know about it, because I'd like to try to get you through it and make it right. So maybe you've had a gastric bypass a long time ago by another surgeon somewhere else, and you've got one of these complications. Well, I'd be glad to see if I can take care of you and make it right. So we talk about, when we talk about gastric bypass complications, we talk about infections, we talk about bleeding that can happen after surgery, we talk about a small bowel obstruction or an internal hernia, a fixable problem if it is brought to the attention of our healthcare providers. Pulmonary embolism, and that's where a blood clot in the legs can break loose and travel to the lungs and plug the blood vessels between the hearts and the lungs. That can be very serious. A stricture, which is a narrowing of the anastomosis, which means the connection between the little pouch and the small intestine. Or ulcers can happen at the anastomosis, that connection between the pouch and the small intestine. And if those happens, we can manage those and take care of them and make it so that it doesn't continue long term. A leak can happen. That's very rare. That's where the connection between the pouch and the small intestine doesn't heal properly and it can leak. Thankfully, we're able to take care of those patients and get them through it when it does happen, but also thankfully is that it doesn't happen very often at all. Malnutrition can happen. I would say that's very rare. When it does happen, we know how to correct it. We can give supplements, we can give vitamins. Usually as time goes on, the difficulty getting enough nutrients starts to fade away, so that after a year or 2 or 3, the patient is then able to get back on a more regular diet and eat regular, whole, healthy foods, and the malnutrition fades away with time. The other operation that I perform for weight loss is called the laparoscopic gastric sleeve, otherwise known as sleeve gastrectomy. Now, a lot of people ask or wonder, do we put a sleeve around the stomach, or is there something implanted to wrap around because it's called sleeve? And the answer is no. All we do in a sleeve gastrectomy is shape the stomach into the shape of a sleeve or a tube. Most of the stomach is removed. You can see in the picture the excised stomach, that lighter color pink part of the stomach that looks like the staples have gone down and cut it away. Well, that part of the stomach is removed and it can't ever come back again. It's a good operation. It combines restrictive and hormonal procedures. That means the restrictive means that it slows down the rate that you're able to eat, makes it so it's hard to eat more than about a half a cup of food over half an hour. Slows you down in that regard. Makes you feel really full if you eat too fast. It also has a hormonal part. As I mentioned earlier, the intestines and the stomach have hormones that they use to communicate with the brain to tell you that you're not hungry or you are hungry. So when the stomach is empty, it makes a hormone that goes to the brain and tells the brain it's time to eat. When the stomach is full or being stretched because it's full of food, it stops making that hormone. So in the gastric sleeve, that empty stomach just really isn't there anymore. So it really works to help people lose weight. This operation is relatively newer. It came out and became popular in the mid-2000s, about 2008, 2009 or so. And it's a good operation. We can expect to lose about half of the excess weight over the course of 3 or 4 years and keep it off for a long time. While the gastric sleeve is a really good operation, it does have some complications that can happen. Heartburn. Individuals that have heartburn before the operation, it becomes worse about 50% of the time. About 25% of the patients with heartburn that have a sleeve gastrectomy will have improvement in their heartburn, and 25% won't have much difference before and after surgery when it comes to their heartburn. Sleeve gastrectomy patients can also have leaks, just like gastric bypass. They can have infections and bleeding, pulmonary embolism, similar to Roux-en-Y gastric bypass, and they can also develop malnutrition, meaning vitamin deficiency, protein deficiencies. And again, the malnutrition and the bleeding and the infection and leak problems are all correctable with time and with expertise of the surgeon performing the operation. We can get you through it, and those problems can be temporary. So overall, the gastric sleeve is a good operation, providing about 50% of the excess weight is lost. With gastric bypass, about 75% of the excess weight is lost. If you're wondering if surgery might be right for you and you're thinking about doing it, one thing you'll wonder are, what do we require before we can have the surgery done? Well, there are a few rules that have to be followed, a few things that need to be done. And you'll see number 1 on the list is no smoking or no nicotine. It's not only no smoking, but not even any nicotine. And the reason is that nicotine inhibits the healing process. And it's very important that that little pouch, that stomach that's been shaped into a sleeve, it's very important that it heals properly so that you have an excellent long-term result. And nicotine inhibits healing, so we can't have any nicotine in the system. Number 2 is that sleep apnea. Many of you already have sleep apnea and you already have CPAP, and if you do, you know how nice it is. You know how good you feel and how awake and alert and how you have more energy during the day while you're being treated for sleep apnea. Many of you haven't been treated for sleep apnea, and you don't even realize that you have sleep apnea. And you don't even know what sleep apnea is. So sleep apnea is when you stop breathing while you're sleeping, which leads to waking up a little bit every hour or two all night long. Your body is craving to get to that very deep sleep. and it's not getting there. So you get out of bed in the morning, and usually you need something to help wake you up, some caffeine maybe. You try to drive a long distance and you're falling asleep at the wheel. Well, it's very important that that gets treated for a number of reasons. One of the more important reasons is that it will help you lose weight if you get your sleep apnea treated. So I really strongly encourage you to get in for a sleep apnea screening test, either with your primary care provider, or we're glad to provide that for you at Mason City Clinic as well. You can call and we can set up an appointment for you to see one of our ear, nose, and throat doctors that takes care of sleep apnea. Next is the monthly healthy lifestyle counseling visits. The number of these will require on your insurance company. The least amount that I've seen is 3. The most I've seen is 12. So call your insurance company, find out how many you have to do in order to get the operation performed, and we'll help schedule those and set those all up for you once you start entering into the program. We need you to have at least one, but we would love you to have all of your healthy lifestyle counseling visits done at Mercy One North Iowa Weight Loss Center. We have you go to the Mercy One North Iowa Weight Loss Center because they work hand in hand with me to help you get ready for surgery, help you learn food and nutrition a little better, help you get some tips and tricks to be successful with this operation, learn about what the dietary requirements are, how eating will go after the operation, how it will go getting ready for surgery. One of the other requirements is that you see a psychiatrist. Usually it's done at the Mason City Clinic psychiatrist, Dr. Lassise, but other psychiatrists are available and are able to perform this psychiatric clearance for bariatric surgery. This is largely driven by your insurance company. Every insurance company that I'm aware of requires that this is done. Before you have a weight loss surgery, you've got to come to the office and meet the surgeon, which is me, Dr. Fabian. I'd like to see you once at the beginning of the process, and I'd like to see you once at the end of the process to see how it's been going. When you get all of the insurance requirements met, I'll be glad to sit down with you, go over weight loss surgery, go over what the recovery is like, go over your particular health care needs, what your medical history is like, what your surgical history is like, and discuss the individual factors that go into the decision of which operation you should have performed, sleeve or bypass. Or maybe surgery isn't right for you, and I'll help you with that decision as well. We always consider whether or not we need to lose weight before we perform one of these operations. If your body mass index is over 50, we're going to have to talk about a requirement for weight loss before we operate on you, and that's for your own safety. If you weigh over 500 pounds, we're going to ask that you get your body weight under 500 pounds prior to scheduling surgery. Usually we ask for about 5 or 10% of your body weight loss to be lost before surgery if your body mass index is over 50. So for example, if you weigh 400 pounds, we're going to start asking for about 20 to 40 pounds of weight loss. Overall, we definitely must not gain any weight during the preoperative program. So in those 3 or 6 or 12 months leading up to getting ready to schedule surgery, you've got to keep your weight the same or drop a little bit. And that's very important for your safety. It makes the operation safer. It makes the complication rate lower. And we really care about making sure that you get through surgery with an excellent result. Once you come for the operation, it'll be a laparoscopic surgery. You'll be in the hospital for 1 night usually, maybe 2 at the most. You'll go home, you'll be on a liquid diet for a week. During the second week, you'll start having a little bit of semi-solid food like just some yogurt or some cottage cheese along with your protein shakes and water. And then you'll see me in the office and we'll look at your incisions. We'll talk about how swallowing's been going. We'll talk about what the next couple of weeks and months will entail and give you a reminder about what you're supposed to be doing. We have you follow up at 3 months, 6 months, 1 year post-op, and then every year after your operation, we'd like to see you follow up with our bariatric program. We draw your blood at 6 months and 1 year, and then every year from there on out, looking for any vitamin deficiencies or protein deficiencies or mineral deficiencies. As you're anticipating coming in to see us for weight loss surgery, start thinking about things related to the operation. Do some research on your own. There's a lot of resources online, a lot of chat rooms and blogs, websites that have a lot of information about the different types of surgeries and about the experience of having weight loss surgery and what the long-term results are like. I'd encourage you all to attend a support group where you can meet people who are once in your shoes and ask them questions. Support groups are offered in Mason City. Just call the Medically Managed Weight Loss Clinic or Mason City Clinic, and we'll let you know when those are. Talk to your insurers, call your health insurance company, and ask them what criteria must be met for approval to make sure your plan covers surgery. I strongly encourage everybody to start an exercise program, and if you're just starting out, take it easy, ease into it, go a little bit longer, a little bit harder, get yourself in shape for surgery, and start this so that it'll become a lifetime habit that is formed for your overall fitness and health. If any of you are smokers or using tobacco, start working on stopping smoking. I see that too commonly, that the patient comes to their appointment with me and they haven't stopped smoking yet. I will help. I'll do what I can to counsel you and guide you along with it and talk to you about smoking cessation. It takes work, it takes an effort, it takes practice. So start practicing today. Now that you've heard all about our program, if you're interested in scheduling a consult appointment with me, Dr. Fabian, just call our office at 641-494-5260. We're located at 250 South Crescent Drive in Mason City, Iowa. Thank you for listening and watching today. I hope it was helpful and informative. If I've left you with any questions, I hope you'll just call our office and I'll be glad to answer them in any way I can.